As a TB doctor, I have worked with a ton of TB nurses, and so I know that they are amazing. You may have not met a TB nurse because they're a special breed. I'm not talking about nurses that diagnose TB. There are many of those. I'm talking about TB nurses who accompany a TB patient throughout the entire treatment. Months of pills, weird side effects, clinic visits, everything. TB nurses are what makes TB treatment effective. It's not the doctor, though we are, of course, brilliant, but it works because TB nurses show up again and again until the patient is across the finish line. Today, I'm going to tell you 3 reasons why TB nurses are amazing. No one, absolutely no one, wakes up in the morning and says, hey, you know what's going to be fun? I think I'm going to take this huge handful of pills every day for the next 6 months. TB treatment is relentless. You cannot miss a single dose if you want to be cured. It's every day for 6, 9, 12 months, but life doesn't stop when you are on TB treatment. People still have jobs, they have kids, they get sick from other things, they feel great one day, horrible the next. TB nurses translate a medical recommendation into a human relationship. And that's why TB treatment is so effective. The nurse remembers who hates swallowing the pills, remembers who needs food before taking their pills, who needs a pat on the back and a soft touch, and who needs a kick in the ass. Adherence is not about compliance. It's about whether there's somebody who cares enough about you to be with you and help you every day while you take your pills. And TB nurses earn that trust one interaction at a time. TB treatment lasts a lot longer than our chronically online attention span. It can be 4 months, 6 months, 9 months, even 18 months. You can be a totally different person by the time that you finish TB treatment. Who remembers exactly what happened during all those months? It's not the doctor. You might see a different TB specialist or ID specialist at the clinic when you go there every month. And trust me, we kind of lost interest after you started feeling a lot better. But TB nurses, they remember everything. They remember how sick you were at the beginning of treatment. They remember that nasty episode of hemoptysis in week 3. They remember that your regimen had to be changed because you started having that side effect in month 3. They keep the story intact when everything else gets fragmented. And that is what's called continuity of care. It's not glamorous. It doesn't get written up in an academic research paper. It doesn't get presented on grand rounds. But it's the difference between a system that exists and a system that actually works. Biochemical pathways are beautiful. Medical guidelines are beautiful. But reality is not. TB drugs kill TB bacteria on paper. On paper, if you swallow the drugs, the bacteria will die and you will be cured. But in real life, people have jobs that they can't lose. People have families that depend on them. People need food on the table and a warm place to sleep. So TB nurses look at the plan that I wrote down in the medical record and say, yeah, that's not going to work. And then they go build the plan that actually does. They figure out how to save the patient without destroying the patient's life. So this is public health wisdom. You don't get that by reading textbooks. You get that by treating hundreds of patients, listening to them, and understanding their struggles. TB nurses are stress tested by reality every day, and it's why TB programs that listen to nurses are going to succeed. If you want your best laid medical plans to succeed and not be choked to death by reality, then listen to the TB nurse. So if you've ever wondered why TB treatment is so effective, look past the hospitals, look past the drugs, look past the textbooks. Look at the TB nurses that make impossible plans human. They are the reason why the system holds together. I talk about TB nurses and patients in this channel. Check out my other videos. I'll see you next time.